This is Dr. Scott McLean. This is a review of the 3800 intraoral scanner. Let's have a look at this. This is a wireless intraoral scanner, and I just had a chance to play around a little bit with it just to see what it was like. It does come with 3 tips, which is very unique. So the first one is for in tight areas. Number 2, you'd use it for things like scanning dentures or in other not so tight areas. And then last, number 3, is more of a panoramic type of view. So the larger this is, the faster that scan's going to happen. So what you can see here is we're going to do an intraoral scan for an implant. And so we'll start by doing the lower arch. Typically your staff would do this first scan. And they would come in and do a full lower arch scan and pick this scan up as we go around the arch. So you can see the wireless scanner is very easy to manipulate, very light and very fast actually. I was impressed with the speed. So looking at this, we're picking up path 1, which is the occlusal. So you're going to do 3 passes really, and then start to fill it in a little bit as well. On the next pass, you're going to see the lingual path, and you can see that when we do this, it's going to stitch to that first occlusal path because we're putting a lot of different images together, and this allows for us then to go scan path number 3, which is buccal. So when you're doing a scan, it's usually 3 scans around, and the more you can get on each of these scans, the better. Sometimes you have to go back in and fill it, but normally it's pretty good. And this is actually doing a good pickup on those first 3 passes. So as we go along, we can see that we're picking up the emergence profile of this area, which is going to be where the implant pickup is. We can also see we've picked up the interproximal, which is sometimes hard for some scanners. So this has picked it up quite nicely, which I'm impressed with. So I was happy with that. And as Wendy takes us around the arch, we're going to go to the upper arch now and start to do the scan. So we're going to be doing this scan fairly quickly actually. You can see path number 1 again is the occlusal path. So you're going to take that right around. So this picks up the incisals and the occlusal tables and allows you to stitch the lingual to the buccal. So as we go around, we're going to come around the arch fairly quickly. So it's not something you should be really nervous of if you've never scanned before. So scan path 2, we're going to go on the lingual. And so for this upper scan, it's usually about three paths. And so as we go around, you can see it's picking up most of the model. Now it is easier to scan a model, so you should always realize that. But on scan path 3 on the buccal, it's coming around quite nicely. So this soft tissue scan is going to be a PLY scan, and that means it's going to be a color. So you can see the pink and the white teeth, and so this can be brought into other files so that you can see what you're doing. So for instance, if you're doing some implant planning, you can bring this in and have it in color for the patient, which is fantastic. So as we come again, we're going to do a free cut so you can tidy up the model, just like you're taking it out to the back and grinding down the plaster. You can cut away different aspects of the model, and most scanners can do this. So scan 3 is going to be bite registration. I like the feature of this scanner because you're doing more than 2. You can do, I think, up to 5. I'm not really quite sure, but I know we did 4 on this demo. And you start by holding it on the upper, grab that, and then move it down. And as you move it down like this, you can start to see that it's going to pick up that quite quickly and get that occlusion right. Now, a quad occlusion is nice because you're taking 4 different spots, which I think is good when you're doing a big bridge or you're just getting more accuracy from an occlusal positioning point, because this is something that's important for all scans, because when you go to print them, then you're able to mount them according to this articulation, especially when you're opening the bite to do bite planes or things like that. Now we're going to take this and do that last record, and you can see here, boom, it's in there and there's the record. So now we're going to take an ELOS body scan and we're going to put the implant mode in action. So this will allow us to go back to the emergence profile area and then do a cut. So we're going to cut a little circle. You can see here we'll cut this on top of the emergence profile area where the implant is showing, and we'll do that cut the hole tactic. And so most scanners will do this pretty much the same. you'll cut the implant out for this scan because we're doing a scan flag. They call it a scan flag, scan body, ELO scan body. There's a whole bunch of different types of scan bodies as well. But once you cut this, you're going to go back in and scan and orient this scan flag. So here we have an ELO scan body. We'll screw it down, take an x-ray to make sure it's seated, and this gets you a positioner. I like to have the flat aspect to the buckle as well, you can see here. So Wendy's doing this. These are not my fingernails, so you can see that. And so Wendy's showing me that when you screw this down, you're actually going to get this flat surface. And so the ELO scan body is positioned so when we go back in with the scanner, we'll actually pick up the teeth in the adjacent area, and this will reference and orient this. So this is doing this quite nicely. And a good scanner is going to pick up the whole scan flag with a lot of problems. So let's see how it works. We kind of rotate around and pick up the complete scan flag or scan body. You can see it there. This will tell the lab how the implant is oriented to the adjacent teeth. And you have a little video as you're doing this that you can see the actual object that you're scanning. Once you have this scan, you push a button and send the STL or the PLY file, which is a digital file, to the dental lab, and they're going to fabricate you an implant crown, which is fantastic. So this is Dr. Scott McLean, and this has been a video about implant dentistry.